Inhalation anthrax occurs when Bacillus anthracis travels into the alveoli of the lungs and infects the bloodstream. As explained in previous learning objects, a person can become infected when they inhale contaminated materials, which usually occur in industrial processing of animal products such as wool or animal hide. Symptoms of inhalation anthrax include shortness of breath, coughing, fever, dizziness, nausea, body aches, excessive sweating, and exhaustion. Many of these symptoms are similar to other common inhalation illnesses such as pneumonia, influenza virus, and even COVID-19. If you suspect that you could be at risk of a Bacillus anthracis infection, you may want to consider contacting a physician about obtaining an RIDT or a rapid influenza diagnosis test, as well as a COVID-19 rapid test to rule out the possibility of being infected by either of those viruses. Suspicion of inhalation anthrax can be more definitively confirmed through examinations of the chest using an X-ray or CT scan. The most scientifically sound way to confirm an anthrax infection is by testing a bodily fluid for the presence of the bacteria. If test results show that you are not experiencing a common flu or infection by COVID-19, you may want to ask your doctor about performing an X-ray or CT scan of the chest. A chest X-ray or CT scan would show mediastinal widening or pleural effusion in patients infected with inhalation anthrax. However, the most definitive way to confirm infection by Bacillus anthracis is to test the respiratory secretions produced by the lungs or conduct a blood test and look for the presence of Bacillus anthracis under a powerful microscope. Such bacteria can be identified by noticing their rod-like shape and groupings into chains. Cutaneous anthrax is the most common form of anthrax infection, and it usually occurs when a person's open lesion or wound is exposed to Bacillus anthracis spores. This usually only occurs when someone is working with infected materials or animals and occurs most commonly on the hands, arms, neck, and face. The most obvious indicator of such a skin infection is the formation of a painless sore or ulcer, most notably with a black center. This infection may also produce blisters or itchy bumps surrounding the site of infection. It is important to rule out the possibility of more minor skin infections such as a poison ivy rash or eczema, as well as more serious ones such as the formation of a melanoma, which usually also has a dark appearance. A melanoma can be identified when a mole forms in an irregular shape with uneven shading, or even when a spot or mole can change in size or shape. Again, although the most sound means of testing for an anthrax infection is using a blood or body fluid test such as a skin lesion swab, a tissue biopsy may also be used to determine if an infection caused is due to a Bacillus anthracis infection. A tissue biopsy is when a doctor uses a sterile surgical tool to cut a small area of the infected skin from the body to be observed under a microscope. If the tissue under the microscope shows chains of a rod-shaped bacteria, the test could indicate the presence of an anthrax infection. Gastrointestinal anthrax occurs when a patient consumes raw or undercooked meat previously infected with Bacillus anthracis. By consuming the raw or undercooked meat, a patient is failing to destroy the infectious bacteria on the meat and contaminating themselves with the infection. Once in the body, Bacillus anthracis spores can infect a person from their mouth all the way to their intestines. Symptoms of gastrointestinal anthrax include swelling of the neck and neck glands, sore throat, hoarseness, nausea, fever or chills, and even bloody vomiting. Because symptoms can infect from the throat all the way to the stomach, gastrointestinal anthrax could possibly be confused with multiple other illnesses. Since many symptoms concern the neck and throat, obtaining a COVID-19 test, influenza test, and or strep throat test can all be beneficial in ruling out these possible other infections. A blood test as well as a stool sample can be used to examine for Bacillus anthracis spores and confirm the presence of a gastrointestinal anthrax infection. Similar to inhalation anthrax, a CT scan can be used on the abdomen to predict if a patient is infected with gastrointestinal anthrax. An abdominal CT scan of a patient infected with GI anthrax could possibly show large amounts of fluid buildup, concentric thickening of the wall of the stomach bowels, as well as enlarged lymph nodes. All of these may indicate a GI anthrax infection.